I'm Adam Allen, President and CEO of Anthem Risk, and I'd like to share a bit about Palmetto Healthcare Stop Loss Program, a medical stop loss alternative that combines the best aspects of commercial stop loss insurance and individual self-insurance. The primary goal of PHSLP and its structure is to benefit its members financially, eliminating the profits and ever-increasing renewal rates of the commercial market. In this respect, it's like individual self-insurance, but it also has the added benefit of group risk sharing to help control cost volatility. The program utilizes a retrospective funding model to provide coverage to its pool of member healthcare organizations. The cost for each member is comprised of three simple components. First, your allocated portion of the group's claims. Second, your cost of excess insurance above the program's pooled layer. And your portion of the program's operating expenses. Again, the primary benefit of this retrospective funding model is the same as individual self-insurance. It minimizes the carrier profits, surplus, or other margins that are built into the amount you pay. But the program improves upon the financial efficiency of individual self-insurance in two important ways. First, you have protection against bad loss years, and your risk is spread across many organizations and several years. So let me explain that. Many organizations remain in the commercial stop-loss insurance market instead of self-insuring because they are concerned about large loss years, as they should be. With specialty drugs, genetic therapies, and other cutting-edge care becoming increasingly common, multi-million-dollar plan participants are no longer a rare occurrence. You should have stop-loss protection at some level, and this program provides that protection. When you individually self-insure your stop-loss, you are a pool of one, and there is nothing to offset your risk when those high-dollar plan participants arise. Year to year, your medical plan and stop-loss costs fluctuate wildly. In this program, your risk is controlled by spreading it across a group of like-minded healthcare organizations. Additionally, each member's allocation of losses is based on their 5 most recent years of claims experience. Since one bad loss year has less impact when bundled with 4 other years of claims experience, your cost variation is reduced even further. Another benefit of considering only the most 5 recent years of claims experience is that you don't get the compounding effect of commercial stop-loss insurance. In the commercial market, your rates will forever include that bad loss year. Think about it. When was the last time your rates went down because your stop-loss claims improved? How do we know this will save you money? Because we benchmarked the program. PHSLP was created in 2011, and since that time, members have saved on average $1.2 million each when compared to the commercial market. So let's talk about the coverage layers. As is the case in commercial insurance, each member decides on a self-insured retention or deductible. The next layer is the program layer. That layer is pooled across the program's members. For all members, that layer is $600,000. To protect the program's members from those high-expense claims that I referred to earlier, each member has excess insurance above the program's $600,000 layer. This excess insurance is purchased as a group for the benefit of group pricing, but is underwritten based on each member's actual loss experience. Next, let's talk about how claims are processed and paid by the program. While it's different from the commercial market, it's actually very straightforward. Similar to your plan today, your third-party administrator will submit any claims to us for those plan participants who have exceeded your stop-loss deductible. At the end of the quarter, members are invoiced. Once members have paid their invoices, each member is reimbursed for the stop-loss claims that they had in the quarter that just closed. Are you wondering how coverage compares to what's provided in the commercial market? The program provides coverage that is better than what's available in the commercial market for one simple reason. The program is governed by the members themselves. If they don't like something about the coverage, they vote to modify the coverage to meet their needs. But here are a few specifics. Coverage is provided on a paid basis. In the commercial market, when you change stop-loss carriers, the typical contract type provided is called a 12-12 contract, which limits your coverage to the 12 months of the new stop-loss policy. With PHSLP, you have coverage for any medical or pharmacy costs that are paid within the policy period, including those that occurred in your previous policy. Of course, this is more coverage for you. The program provides reimbursement at 50% for care provided within your system, also known as domestic care. The program does not apply any new lasers within the pooled layer for new members, nor does it apply new lasers for existing members at renewal. Let's highlight a few of the advantages of membership in the program when compared with the commercial market. First, by virtue of its structure, the program is going to be lower in cost. Second, your policy in the program is written to follow your underlying plan document. This avoids a potential gap in coverage. Next, members govern the program. If the structure or coverage provided can be changed to benefit the participating members, the group can customize the coverage to meet the needs of the pool. And finally, it's common for stop-loss carriers to increase their rates by 10 to 15% or more every year, regardless of your loss experience. By smoothing your risk across a pool of members, considering only the most 5 recent years of claims experience, and removing carrier profits and margins, your cost from year to year is less volatile than it would be in the commercial market. Ready to learn more about Palmetto Healthcare Stop Loss Program? Email us at info@antumrisk.com or call us at 803-461-8372, and we will be happy to answer your questions. Thanks again for considering Palmetto Healthcare Stop Loss Program.